Everyone, and welcome to today's webcast featuring an introduction to the Child HCAHPS Survey database. My name is Dale Schaller, and I'll be moderating our session today, which is presented by the Agency for Healthcare Research and Quality's, or AHRQ's, CAHPS User Network. Next slide. Our agenda for today is on the screen here. We'll begin with a few welcoming remarks from AHRQ. That'll be followed by an overview of the Child HCAHPS Survey itself, commonly referred to as Child HCAHPS. And then we're going to move into a description of the CAHPS databases that are sponsored and funded by AHRQ, with a focus on our new Child HCAHPS Survey database, including its benefits and steps for participation. And as always, we'll try to leave as much time as possible for your questions, which we encourage you to submit anytime during the webcast. Next slide. Before we dive in, I just want to go over a few housekeeping details. If you're having difficulty with the audio from your computer speakers, you can change the audio selection so that WebEx calls you back, and so you can connect through your phone instead. If your computer freezes up for any reason during the presentations, just try logging out and logging back in. And if you need any help at any time during the webcast, we ask you to use the Q&A feature, which I'm going to describe on the next slide. So your browser may look different than this screenshot, but in any case, look for the Q&A icon at the lower right-hand side of your screen, and be sure that the drop-down box displays all panelists so that we can all see your question. And if you do feel inclined, please include your name and your organization when you submit a question so we know a little bit about where you're coming from. Today's session, as all of our webcasts, is being recorded, and the slides and the recording will be made available on the CAHPS site in the future. But, and this is really important, you can already download the slides for today's webcast and view some important background materials on the webcast event page, which was sent to you as a registrant a couple hours before we began today. And we will post again in the Q&A box so that you can just hit the URL and go right to the event page and have that information available to you. Next slide. So I'd like to now welcome and introduce our speakers for the webcast today. We're beginning with, as I mentioned, some introductory comments from Karen Ginsberg, who directs the Agency for Healthcare Research and Quality's CAHPS program, as well as the Surveys on Patient Safety Culture, or SOPS program. Karen will be followed by Sarah Toomey, who serves in multiple roles at Boston Children's Hospital. Welcome, Sarah. She is the Chief Safety and Quality Officer. She's a Senior VP. She's the Chief Experience Officer, and she's the Director and Principal Investigator of the Center of Excellence for Pediatric Quality Measurement, also funded by AHRQ. Josh Rubin is the manager of the Child HCAHPS Survey database at Westat, and Josh and I and Sarah will together be discussing the new database and how it works and its benefits. Again, I'm Dale Schaller, and I've been a member of the CAHPS Consortium for a long time and also serve as a senior advisor to the CAHPS database. So with that, Karen, I'm pleased to turn it over to you.
Thanks, Dale, and welcome everybody. I'm so happy to present this new work to you, this new database for Child HCAHPS. And before we start on the heart of the program, because this work involves you submitting data to a federal government supported database, I wanted to tell you a little bit about our agency so that you understand the context in which you will be submitting data. And so can I have the first slide, please? So let me tell you a little bit about our agency and our core competencies. We're a science-based agency, part of the Department of Health and Human Services. And what we do is invest in research and evidence to make healthcare safer and to improve quality. And we generate measures and data that are used by providers and policymakers to improve performance of the U.S. healthcare system. And we create tools to assist in improving performance. So it's important for us to get our science out to you, our users, and to push our science to implementation so that you can use our tools and products and benefit from the science that we're pushing forward. And so this database is one of those tools and products. We are not a regulatory agency. We can't require the use of our tools and products. All of the work that you see from the CAHPS program is that you participate in is voluntary. It's up to you. We do not require any or mandate any of our surveys or tools here. The CAHPS program is a program to advance the understanding and measurement and improvement of patients' experiences with their healthcare. We develop surveys, we conduct research on patient experience, we manage voluntary databases. Can I have the next slide, please? So the databases are a large part of what we do. We manage these voluntary databases for selected CAHPS surveys, including our health plan survey, clinician and group survey, which we've suspended data submission for that, but the data are still available. Should you need it for our home and community-based services survey, and then this new effort, Child HCAHPS Survey. AHRQ has been funding this work, funding the CAHPS program for about 27 years now. The databases are administered by our contractor, Webcast, and I want to just state that that we don't ever publish organizationally specific identifiable data. None of it is ever publicly reported. Webcast manages the data intake and the data processing and the production of the reports. They ask you to complete a data use agreement, and that's to assure data privacy and protection so that you know how your data are being used. And you're going to hear more about this through the presentation. So again, thanks for joining us, and I'm going to turn this over to Sarah.
Hi, thank you all. I'm really looking forward to talking today about Child HCAHPS. I am one of the co-lead developers of the Child HCAHPS Survey. If you go to the next slide, please. The Child HCAHPS Survey was developed in 2015 by the Center of Excellence for Pediatric Quality Measurement here at Boston Children's as part of the Pediatric Quality Measures Program, the PQMP. Survey itself is a parent or guardian report on inpatient experience of care for children under the age of 18, so 17 and under. And there are 18 single item and composite measures that hopefully many of you are familiar with. These measures have been grouped into 5 overarching areas: communication with a parent, communication with a child, attention to safety and comfort, hospital environment, and hospital rating. And for more information on the development of Child HCAHPS, you could go to the website on the AHRQ.gov CAHPS surveys guidance //hospital/child_HP_survey.html. Next slide, please. I thought it would be important just to give you a sense of some of the measures that are part of the Child HCAHPS survey. And here are some example questions under those 5 overarching groups. The first, for communication with parents, is keeping you informed about your child's care. And the average hospital top box score, and this is based on our national field test that we did back in 2014 to 15, for which we had 69 hospitals participate. And what you see here is the average hospital top box score was 72%. If you look at the composite of, or the overarching group of communication with child, if you look at how well nurses communicate with your child, the overall average top box score was 70%. You look under attention to safety and comfort, preventing mistakes and helping you report concerns, it's 56%. Hospital environment was quietness of the hospital room, 63%. And when you look at overall rating, the average hospital top box score was 75%. So as you can see here, based on those scores, we really did think that there was room for improvement. Next slide. One other important aspect when you think of any good quality measures, look to see whether there's variation across hospitals. And so what this shows, once again, from our national field test, is as you look across, each bar is one of the hospitals that participated in our national field test. And what you see is there is quite a bit of variability. So while the average, as we had said before, was at 75%, there are hospitals for which they performed much lower and higher than that average score. And this is statistically significant. Next slide. Now I'm going to hand it over to Dale to talk a little bit more about the Child HCAHPS Survey database.
Yeah, thanks, Sarah. That was a great overview of the Child HCAHPS Survey itself. And now we're going to move into our plans for the Child HCAHPS Survey database. So the next slide, please. So I'm just going to build on a few of Karen's opening remarks to highlight a few features that are common to all of the CAHPS databases that are supported by AHRQ. And the first is that participation is entirely voluntary and open to all users of the surveys that are supported by the database. For each database, we have an annual cycle of submissions and reporting. So there's a set time period in each year for each database during which organizations that have administered that particular survey are asked to submit their data. And then the reporting usually follows 2 to 3 months after that submission period. Because it's a voluntary database, submissions do vary from year to year. And so we make a point of saying that our data, as comprehensive as possible, are not representative necessarily of the US for any particular CAHPS survey. Karen has already mentioned, and we really want to highlight the fact that no organization identifying data is ever publicly reported. It's very important to distinguish this kind of a database from other sort of public reporting databases that are out there, be they from CMS or NCQA or other state agencies. This is much more a quality improvement and research-oriented database for your participation. Submitters sign what we call the data use agreement, or a DUA, that assures that we will protect the data, keep it confidential, and it also sort of memorializes the agreements that we have, how we're going to use the data. And we'll say a little bit more about the DUA in a minute for the Child HCAHPS Survey database. Next slide. So each database that we maintain has 4 basic kinds of products. The first is an online data portal, which is accessible to anyone with access to the internet. You can go online and view summary level data results for each database that is supported on the portal. You can download and print customized reports. And when I say summary level, I'm talking about the data that are submitted that are aggregated together. So again, no organization-specific information is provided in that public space. The AHRQ Data Tools is a new site that is actually combines some other tools that AHRQ supports, including the MEPS survey, the Medical Expenditure Panel Survey, the HCAHPS survey for hospitals, as well as the National Healthcare Quality and Disparities Report. So a very useful place to go. We also, for each database, produce what we call an annual Chartbook, which is a more or less static report that we create for you that presents summary level data again with certain insights and analyses that we think are useful to users. And this is available, again, sort of for downloading in our public websites. Privately, not available to the public, are what we call private feedback reports. And these are organization-specific reports. They're basically a simple Excel file that we produce that compares the data that we are receiving from you as a participating organization to the averages for that particular survey. And it's we make it as simple as possible so you can manipulate it and use it for your own sort of internal reporting and exporting and importing into other reports that you might want to create. And finally, we have research data sets that are created for access only to organizations, research organizations that submit to us a proposal for research that is reviewed and approved by our team at WestEd and also by AHRQ. And this information, again, does not identify organizations unless we have your permission to do so. And we'll talk a little bit about that again in the context of the Child HCAHPS Survey database in a moment. So let's go to the next slide and talk about the Child HCAHPS Survey database. So again, it will be open, and we invite all users of the Child HCAHPS Survey to participate, whether you are a freestanding, self-governing children's hospital, whether you are a children's hospital that has a hospital within a hospital, which is a term we've gotten to know, meaning you're a generalized hospital, but you also have a dedicated portion of your system dedicated to children's pediatric care. We also, understand that there are a number of users of the Child HCAHPS survey that are simply pediatric units within a hospital. So across these different sort of organizational types, we would welcome all users of the CAHPS survey for children. In this inaugural year, to this year, 2022, we will consider this a pilot year, as we do for all of our sort of startup databases. And as such, they're designed to be as inclusive as possible. And so we, in this startup period for 2022, will be accepting Child HCAHPS survey data collected in the calendar year 2021, so from January through February of last year. We do want the surveys that you have used to conform to certain specifications for submission. So questions need to be worded the same way that they're supposed to be for the Child HCAHPS survey, in the same order. And it's very important at the end of all CAHPS surveys, we have the respondent information, demographic information about who filled out the survey. We need that information for doing what we call case mix adjustment of the findings, whether we're comparing an individual organization's scores to the average within our private feedback reports, or whether we're allowing you to compare your sort of results to other organizations that might be willing to share their data with you. So we use case mix adjustment as we do with all CAHPS surveys that we support in the CAHPS database. In this case, if there are three variables that we use, it would be the age of the parent, since as Sarah mentioned, this is a survey that's filled out by the parent or the guardian of the child. We will also ask for the education of the parent, and then the health status of the child. So, and those are three variables that are wrapped into our case mix adjusted algorithm for making the comparison of survey results as comparable as possible. I also want to say that in this inaugural year, we have no sort of minimum number of surveys that you can submit. Again, we're sort of open to all comers. So whether it's a lot or a small number of surveys that you have collected during the 2021 calendar year, we welcome your participation in 2022. Next slide, please. So I mentioned in general what the Chartbook is designed to do. And so we're envisioning a Chartbook for this first year of Child HCAHPS survey data that would highlight sort of key findings, present composites and question items broken out by certain characteristics that we've learned in talking to a number of children's hospitals and a sort of a period of outreach that we've been doing in the early part of this year. Things like the region of the hospital, whether it's in an urban or rural location, the pediatric bed size of the hospital, the units, whether it's a freestanding or a hospital within a hospital configuration, teaching status, and other characteristics that would be reported to us by the participating organization. And again, we're emphasizing that this is not a public reporting database. No individual hospital results will ever be publicly reported. Next slide. This is just an example of the kind of bar chart which we use a lot in our chart books and actually on the online reporting systems as well, that shows how we would display, again, in aggregate level form, the distribution of scores for a particular question or a question composite, in this case, communication issues between you as a parent and your child's nurses, showing sort of a breakout by region. And we would have the number of responses that go into the breakout and then go through and sort of present a number of bar charts in this fashion that shows the distribution of responses. This is all dummy data just for illustration. So next slide. The private feedback report that I mentioned for the Child HCAHPS Survey database will look something like this. And we're sort of still figuring out what is the best way to format this. But the basic idea, again, is a simple Excel spreadsheet that would display for each question and the composite related to each question, the distribution of survey responses in terms of the actual scores. where we would show the overall average for the Child HCAHPS database in sort of a top row. If there were an association or a collaborative of hospitals that might get together and agree that they'd like to pool their data for sort of a different sort of kind of peer comparison average, we would be able to create that and use that also in the sample, in this private feedback report template. And then, of course, whatever the individual unit is that is submitting the data, whether it's a health system or it's individual component hospitals or a pediatric unit within a hospital, those scores would then be displayed along, in this case, the rows. So we would also be using a statistical test of significance that again relies on the case mix adjustment that I mentioned, that would compare the mean score for each one of these questions in the composites to the average for the database. In this case, we would show a significance test of 0.05, whether it's those scores are above, below, or at the average for the database average. And those are indicated here, again, just sort of in a sample way by the numbers 2 at, 3 above, and 1 below the average. Next slide, please. So I mentioned the research data files as a product of the database, and the data use agreement that we asked to be completed upon submission of your data. So the DUA provides for us to release de-identified hospital data. Again, no identifiers for individual hospitals upon receiving a research request. Because of the interest we have discovered along the way leading up to developing this database, that a number of children's hospitals that want to participate would like the opportunity to be able to link the Child HCAHPS survey data to other performance measures, be they other sort of clinical or quality safety metrics or utilization or financial metrics. We're providing in our DUA an option, a choice of options for you to either provide the selective release of your hospital identifiable data, where you would have the opportunity to review each data research request and decide whether you want to allow your hospital identifiable data to be released to that researcher, or whether you would choose to just allow your hospital identifiable data to be released to all research requests, or whether you would never, clearly this is your choice, want your hospital identifiable data to ever be released for any research purpose. And again, this is something that you would choose, you would elect to do with the data use agreement. And we have constructed the DUA this way to make it a lot easier, because of the interest in the potential linkage for research purposes, to not have to go back to every single hospital that has submitted data to us to ask for your release on every single case. So we've set it up this way to make it as sort of streamlined as possible for us to supply this information upon request and upon approval to qualifying research organizations. So I think with that, I am now ready to turn it over to you, Josh, to talk a little bit about the steps required for participation. I'm sorry.
Nope, I think it's actually
take that
me. I'm
back.
going next. That's okay.
Sarah, it's back to you, so we can hear
It's
from
me.
you about your impressions of why this is a good thing to do.
Yes, no, I'm really happy to be able to share some thoughts here. So once again, I'm coming at this from multiple different lenses, but I think the two main lenses that I'm bringing to this conversation are, first, as Chief Experience Officer at the hospital, trying really hard to move the needle and understand better how we can improve our benchmarks to understand how we're doing. And then secondly, as a researcher, and I've had experience using some of the other AHRQ databases, which have just been really a wonderful opportunity, in particular in pediatrics. So let me first start here by just giving a high level as to what I think is really important about this opportunity for us. First of all, it's just that this is the first comprehensive database for Child HCAHPS that that will be available to anybody who requests it and is able to demonstrate some need. And then it also cuts across for all of us, survey vendor, and it gives us an opportunity, as Dale was saying, to create our own groups in regards to peer comparisons. I've had an opportunity to be part of a number of different initiatives that have cut across different organizations. And I have to say, a lot of those would really benefit from this ability to be able to create groups, to be able to have a way to share regardless of how we're collecting the data, and to really learn from one another. I think the other real important thing to say here is that this will be an opportunity to case mix adjust our results. And case mix adjustment really does allow us to better understand how we compare to others. And from my perspective, the comparative data can be used for identifying opportunities for improvement. I'm going to give a couple of examples of that, and also of tracking our progress over time. And I think, what's been shown around the CAHPS databases is that they really have been used to demonstrate sort of changes in patient experience, and to be able to, I think, demonstrate where we've been able to improve and where we still have efforts that are needed to make the experience of our patients and families better. The last thing just to say is that as much as I would intend and do intend to use this at a local level, I think that this database will provide us research opportunities to, as Dale said, connect potentially and link to other data sources, but even within the database itself, is to answer in a more generalizable way some of the questions that we have around experience, to be able to understand better what's associated with positive patient experience, to understand what the variation is over time and the variation across hospitals, and then also how we are performing over time. I wanted to just say that pediatric hospitals are using Child HCAHPS across the country, and they really have been able to measure and enhance the care that's being provided. And our CAHPS, Child HCAHPS toolkit highlights some QI case studies, and these span multiple different dimensions in care. As I was saying, there have been multiple different dimensions for which people have been able to improve, from improving communication with providers, preparing families for discharge, engaging over pain management, and also just overall willingness to recommend. So as I said, the AHRQ Child HCAHPS toolkit highlights multiple QI cases, and that resource can be found at www.arc.gov/PQMP/implementation-QI/toolkit/Child HCAHPS/index.html. Next slide, please. I thought it would be important for today just to give two case studies. The first is around improving communication with nurses. Here, the goal of this, and we advance the next slide. Yes? Nope, sorry, go back one. I just wanted to make sure that I was on the right one for the team. So the first was around improving Child HCAHPS nurse-child communication. And this hospital was trying to improve its scores above the 75th percentile. They put in a series of interventions through a communication bundle with bedside nurse shift reporting, whiteboards, and scripting. And their outcome measures were two different questions in the communication composite. One around how often the nurse listened carefully to the child, and the second is how often the nurse explained things in a way that was easy to understand. And through these interventions, as you can see, they were able to make meaningful improvements in nurse communication. Next slide, please. In the second case study on improving pain management, here again, the goal was to try to engage patients and families in communications and conversations about pain management to improve the effectiveness of pain treatment. The intervention involved patient care technology and also new pain assessment workflows. And the outcome measure they used was response to the Child HCAHPS question of, did staff do everything they could to manage your child's pain? So what you can see here again is that they were able to make meaningful improvement through these interventions, yet again demonstrating that Child HCAHPS not only can measure meaningful aspects of the inpatient pediatric care experience, but also can drive change and lead to improvement. Next slide, please. Now I'd like to head it over to Joshua for give us an understanding of the steps for participation.
Hello, everyone. My name's Josh Rubin, and I'm going to go over, in general, the steps for hospitals and vendors to participate in the Child HCAHPS Survey data submission process. So, Michelle, next slide, please. So, users of the Child HCAHPS Survey can start submitting their data on May 2nd. Again, this is a pilot year. The submission will be from May 2nd through May 20th. The survey data collected will be from January to December 2021, and I'll be going through the steps to participate in the next slide. Reporting products will be available in the fall of 2022. Participation is free and open to all Child HCAHPS Survey users on a voluntary basis. Of note, Gov delivery announcements will be going out prior and during the data submission. If you would like to see up to date on any news or dates regarding Child HCAHPS data submission, I encourage you to sign up for the Gov Delivery listserv. Next slide, please. So let's talk about the Child HCAHPS data submission process. It's really a 4-step process. The first step, step 1, the users, the submitters will go to the Child HCAHPS submission page, and they'll register for an account once submission is open. At this point, we're going to ask some general information from the hospitals and vendors. And once the account is registered and approved, the submitter can log in and start the data submission process. So once you're registered, hospitals will need to provide a signed DUA, which is available on the Child HCAHPS submission page, and it specifies how the data will be used and stored. Staff will review the DUA and approve it. The third step prior to data submission is that we request a copy of the survey instrument. Staff reviews the survey instruments to ensure that it adheres to CAHPS standards. So once you get into the system, you upload the DUA and that's approved, you'll then be prompted to supply a questionnaire, a survey instrument. We'll review that and approve it, and then we hit step 4, which is where you can actually submit your data. So at this point, hospital survey vendors will submit their data files that have been formatted to the Child HCAHPS data specifications, which are located on the Child HCAHPS submission page. That the vendors and hospitals should review these specs prior to data submission. And once the data files are submitted, each file is reviewed and approved by staff. In the process, it's important to note that if a vendor represents multiple hospitals, they will have the ability to upload zip files to submit multiple data files at once. So there will be really multiple pathways available to submit data in a system. The submitters can either upload each hospital data file individually, or for those vendors with many hospitals, they can upload a zip file containing multiple files. If there's any issues with the data submission, for example, if a file doesn't line up with the data specs, the submitter will receive an error message and will be able to go back in their file, fix the error, and resubmit it. Additionally, we have staff available and ready for TA, which we'll talk about shortly. Next slide, please. Once that data submission period is opened, on the sort of screenshot below here, there'll be a registration box to your right, where people will be able to log in and create their accounts. For users that have used the CAHPS databases for other surveys, the process will be familiar. And for new users, the process is intuitive. Next slide, please. So participating hospitals can be assured that their data are kept confidential and no hospital names or other identifying information are ever made publicly available. As we mentioned earlier, data will be kept confidential, but the DOA will provide options to allow hospitals to release identifiable data for research purposes only. Next slide. In terms of TA, the CAHPS Database team at WESTRA offers free technical assistance with data submission issues, responding to questions regarding the data submission process. Should a submitter encounter any issue during the process, we have staff ready to help out and with answer any of their questions, TA, or anything they may need help with in a submission process. We also have staff available to answer questions about public reporting products, which would include for Child HCAHPS at Chartbook, and also any questions on how to obtain research data sets. So thank you, and I'll turn things back over to Dale.
All right. Well, thank you, Josh, and thank you, Sarah, and thank you, Karen. We have come to the point of the webcast where we can field your questions with some answers, and we have had a few that have come in already. I want to, Michelle, have you advance to the next slide, which just repeats the guidance for submitting a question using the Q&A box. So a couple of things have come in, and one is a really interesting question. That's from Don Leiter, who asks about whether surveys administered to patients in hospital at home, which is kind of a new development in the health system, partly due to COVID and just sort of changing medical practices. This is actually a really interesting question, and I'm not sure that the database team has had a chance to thoroughly think about this, but I welcome comments from you, Josh, or Dan, or even you, Sarah, in terms of if a survey, the Child HCAHPS survey, is administered to a patient experiencing hospital at home, it would be creating a new sort of category of submission, which I think we're definitely open to doing. But I'm not sure that we had thought about that particular classification until the question was posed. Any thoughts on that?
It'll be interesting to see. I think it's a new concept of
Yeah.
hospital at home more generally. I think to some extent the questions do apply in many regards. So in that context, I could imagine that it would apply, but I'm not 100% sure how how extensive hospital at home is currently, although I can only imagine it's going to grow. So I think it is something that we'll have to really consider.
I agree. Yeah. Well, thank you for the question. I think it's really helpful. Sarah, this question is for you. Mary Emmett at the CMC Institute asks, when did the Child HCAHPS survey become available for use? And you've already sort of talked about its development. Do you want to elaborate on that?
Sure. The national field test, as I was stating, happened in 2014, and it was 2015 that it was approved. It was in not only by AHRQ, but also by NQF. And so we've been fielding actively in hospitals around the country, Child HCAHPS since that time.
Right. There were a few questions that were submitted in the registration process that sort of build on this question of its development, and it has to do with whether or how often the content of the Child HCAHPS survey as it's currently constructed is reviewed, the potential for updates or modifications, in particular, whether it's possible to think that the questionnaire could actually be shortened. So Karen, I'm going to direct that set of sort of questions about survey length and content to you.
Thanks, Dale. I love these questions. I mean, these questions mean that people are using the survey, they're thinking critically about it, they are communicating, ways that the survey could be improved. And what I'm going to ask you to do is, these modification questions are actually complicated internally to give you, they're complicated and I can't give you a short answer, but what I'm going to ask you to do is to email. There should be an address for technical assistance if somebody could read that out, and just email your questions so I have a written record of them, and then I'm going to share them internally. As Sarah mentioned, the survey development was supported by a program that wasn't the CAHPS program. And so I want to be able to share this with the original survey funders and talk to them about what their goals are. So thanks. Just let us know what the concerns are.
Great. Thank you, Karen. So I have a couple of questions, Josh, for you related to submission. First of all, from Wake Med Health and Hospitals, can you just clarify whether the registration begins on May 2nd or data submission begins on May 2nd or both?
That would be both. So once data submission opens, the registration box on that URL from the slideshow will become live on the CAHPS submission site. So it's really, once submission opens, that's when registrations can open.
Okay. And this is a really interesting question. I don't think we've ever had this before in the years we've been maintaining the databases. Is, does WestET store the data that are submitted domestically, or I would assume the alternative would be in some sort of international space? What's your answer to that?
I believe I might have to get back to, but I believe we do store data domestically.
Okay. Yeah. Here's a question for, I guess, you two as well, Josh, in terms of, are we accepting surveys that were collected by mail only, or will we accept data that are collected through other modes, such as telephone, or in this case, e-surveys? Electronically admitted surveys.
I have to double check on that one. I know we're accepting by telephone and mail, but I need to check back with that information that's in the data specifications, I believe.
Well, I'm pretty sure, if I can just add to that, the data specs do ask for mode of administration. So
yeah.
If the data were collected electronically through online collection, we would accept that data.
Yeah.
And we're marking, by the way, how, this is when Josh was mentioning the data specs, there is information about not only sort of the kind of hospital and characteristics that I reviewed, but also the way in which the survey was actually administered, how it was sampled, the sample frame. There are a number of fields that are in addition to the actual questions that each respondent fills out. And again, those data specs, the data use agreement that we've talked about, and obviously the slides for today are available currently both on the Webcast event page, which is the URL that was provided, or on the new submission page that Josh referred to, and that URL is embedded in the slide deck. I also just want to say, sort of, this May 2nd date is actually not that far away. And for those of you who have collected Child HCAHPS data in the prior year, in 2021, we would really encourage you to start thinking now about particularly the data use agreement, because while it's fairly straightforward, oftentimes organizations, we find it takes a while to sort of walk up through the different levels required in the organization to get approval and sign off. So we would encourage you to kind of start the process now. And again, if you have any questions about what's required, what we're asking for submission, or in the DUA, or how we intend to report the data, you've got the information for getting in touch with us. Let me move on to a question for you, Karen. We've described this inaugural year for the database as a pilot. The question is from Rose Carrion: is AHRQ working towards any sort of reimbursement as CMS does for adult care?
Thanks for that question. AHRQ doesn't manage or operate programs, reimbursement programs, the way CMS or other agencies might manage them. So that's a question that CMS might want to answer. AHRQ, as a science-based agency, we don't have the authority to require data submission or participation in a program. I think the word pilot, I know CMS uses pilot in a different way than we might. This pilot is to just understand, the to open the database for the first time and see how it works and see who's submitting, and the something about understanding some of the characteristics of the data that are submitted. So that's how it's a pilot, so we can improve data submission in upcoming years. But it's not a pilot for a mandatory reporting program.
Right. Great. Thanks, Karen. So here's a question, Sarah, that I'm going to toss to you. It's from Sam Osakawa, asking if, and this is a development question, so wondering if any millennial or Gen Z parents were involved in the design of the survey. And a related question, do you have any data on the willingness of this audience, I'm assuming Gen Z and millennial, to complete a 62 question item survey?
Yeah, no, it's a great question. So in terms of the development, we did extensive focus groups and also cognitive interviews with parents of all ages, in addition actually to doing some with adolescents, to make sure that the topics that we were including resonated with everyone, because obviously one of the cornerstones of developing a good patient experience survey is to make sure that what we're covering is meaningful and important to patients and families. In regards to the second question, and of do we know about the willingness of this audience or this age group to complete the survey, and I should just make a little side note to say, even though the survey is 62 items long, there are many skip patterns involved, right? We have screener questions to make sure that people are only answering questions that are relevant to them. So most people answer just a subset of the questions. That said, the answer is, what we have looked at is the response rate by age. And I would say that the response rate for the Child HCAHPS survey for parents mirrors the response rate for the same age group for the other CAHPS surveys. So that certainly there are differences by age, and the younger age groups, the response rate is slightly lower. But once again, it was in line with the other work that's been done in terms of age-based response rates.
Great. Thank you for the clarifying information. I see a question in the queue. How will benchmarks be determined? So I'll take that one, because with all of our databases, what we do at the minimum is we aggregate the data that are submitted, and depending on how complete the information is that we get regarding characteristics of the organization, be it a hospital, a medical practice, a health plan, we create sort of a comparative indicator or comparative benchmark, if you will, that combines responses to those questions for that particular category. So the benchmarks are another word for the comparative results that we provide through the database that are put together based on the submitted data. And we try to, again, sort of categorize them and create levels of comparison that are most meaningful to organizations that are submitting data. I think we have so far run through the questions that have been submitted thus far. Again, during the registration process, we had a number of questions that I think we've answered already, but just to touch on with this sort of new database for Child HCAHPS is kind of a more intimate community than some of the surveys that are out there for CAHPS, like the health plan survey. We're really curious to know how many organizations are using the survey. I think we'll get a sense of that when the submission period opens. We really want to encourage all of you that have had some experience using the survey to submit your data. If you have any questions at all about whether your collected data will actually comply with submission, we encourage you to get in touch with the WestAT team with the contact information that is provided, and we'll go over that again at the end of the webcast. And if you have any question about moving forward, if you've already collected data or you're thinking about collecting data using Child HCAHPS, if you have any questions about whether your survey instrument qualifies, please don't hesitate to send that to the database team for review, and we can give you feedback on a case-by-case basis. I have another question here. For organizations who want to specifically be compared to others in the private reports, will there be a minimum number of facilities to be compared to? That's a really good question, and I think that's really one that we have to sort of answer empirically as the database grows. I think we do have suppression rules and thresholds for presenting data. How we will apply that to this new Child HCAHPS Survey database, we will yet to be determined, but we'll come up with a threshold number. I think it's too early to say for the Child HCAHPS Survey database. As I mentioned earlier, we don't have a minimum number of surveys for submission. So again, if you have any questions about whether or not the data you've collected would qualify, just please reach out and let us know, and we'll get back to you as soon as we can. Yeah, here's another question for you, Ken. I think you've already addressed this, but just to really clarify the role of AHRQ in sponsoring these databases, the question is, if we know if CMS will be requiring this survey at some point down the road, and I know that you would like to answer that.
Yeah, thanks. I can't speak for what CMS is going to do. I don't know when, I don't know what they're going to do or not. And that's a question that you would need to ask CMS. But I do want to say, the purposes of the reason why AHRQ has invested in the CAHPS program for 27 years now is to help provide people with and facilities with the tools they need to improve care and to monitor their progress. This is a quality improvement tool, and it helps us, it helps you chart your efforts to improve quality, provide data to the extent that you all can provide it to us to be able to use to conduct research, health services research. I mean, that's why we do this. And we don't do it with the intent of publicly reporting or establishing data submission programs. It's not our goal. AHRQ's the lead federal agency charged with patient safety research, and the CAHPS program is firmly embedded in the Center for Quality Improvement and Patient Safety, and we view the CAHPS survey as one of the tools used to improve, patient safety, improving patient experiences, improving patient safety. And so this is one of our quality improvement tools that we want to make available to you should you want to use it.
Thanks, Karen. So Joe, a couple of other questions that have come in through the registration process. We have just a few minutes. I think we can address these in terms of this being a free database for participation. The question is, if there is no cost to participate, does that also include the customized private reports that we've described? Are those also free of charge? Josh, do you want to take that one?
Yep. Yeah, the private reports will be made available to all submitters free of charge, and access to the Chartbook and the de-identified data sets are also free of charge. Yeah, so.
Okay.
Yep.
And another question I think that might be of interest to all participants is, can you give a few examples of the kinds of research purposes that have been sort of submitted in the past for using the de-identified research data sets?
Sure. Yeah. In the past, some examples of approved research requests included use for dissertation, research for quality improvement efforts, and white papers, and also some presentations.
Right. And I think, Sarah, you've given some examples of possible ways in which the data set with appropriate permissions by the submitting organization could be potentially linked to other data sets for some interesting research and analyses. So I think, this database will be, I think, uniquely positioned to do that kind of research, provided that we get a sufficient number of submissions, which we hope will happen.
Yeah, I agree. And I can give another just concrete example of a project that we're finishing right now using the health plan CAHPS database, whereby we're looking at differences between adults and children across sort of different racial ethnic groups in the responses to a health plan CAHPS. And so we've been working with some of the CAHPS statisticians and others in doing that that analysis. And so there really will be many opportunities, and the fact that there's the potential to link, Dale, as you said, to other databases will really provide us with the potential to explore better where patient experience fits into, as Karen so aptly put, you know, our safety journey and thinking about other types of outcomes.
Yeah, great. Thanks for that. I have one more question I think we have time to field. Just came in from Jamie Kim regarding the sample level data file. So someone's already looked at the data specs. Is the record level data deduplicated? For example, a child may have had multiple admissions and may have different level of experiences. So what sort of deduplication is performed on the research data files? Josh and or Dan?
Dan, do you want to field that one?
Sure. So I think this is probably going to depend on the vendor, depending on, I would assume that they would de-identify the data before they submit it to us. We aren't expecting to receive any identifying information, so we would not be able to determine whether a record is duplicate.
Okay, these have been great questions, and I want to sort of move on to sort of our closing couple of slides. So Michelle, if you could advance to the next slide. So we have an opportunity to put out information periodically about the CAHPS program. We encourage everyone to sign up for these updates. They are sent by Gov Delivery. And the way to do that is to go onto the CAHPS or the AHRQ website, and you find the little sort of icon that says email update in the upper right-hand corner. That gets you to a page where you fill out a drop-down menu, which you can select for many different kinds of federal sort of updates. CAHPS is part of that. So you would just check those items and you would be then eligible to receive the kinds of announcements that led to this webcast, our announcement of data submission opening and closing, publications and important announcements from the CAHPS team about new surveys and things that we're learning that would be of interest to you. Next slide. So we've emphasized, I think, quite a few times that we are here to answer your questions that come up on a case-by-case basis regarding submission, regarding use of the Child HCAHPS Survey. You can reach us by email at the CAHPS Database at westat.com email address. Our sort of toll-free number is listed here at 888-808-7108. That directs you directly to the CAHPS Database team. And then our website address for the AHRQ CAHPS site in general is listed here as well, www.ahrq.gov/CAHPS. And that concludes our webcast today. Michelle, I think that's our final slide. You will be directed, I think, as you sign on to complete a short evaluation. We encourage you to do that. And again, get in touch with us if you have any questions at all. We are here to be as helpful as possible. And we really encourage all of you that have had experience with the Child HCAHPS Survey to submit your data starting on May 2nd. So with that, thanks again to Josh, to Sarah, to Karen, and to all of you for participating in today's webcast, and have a great rest of your day.